Good
Hi,
evening.
hi,
We are
everybody.
live. We're
Yay.
here to answer your questions about chronic care management. We have an exciting opportunity coming up for for those of you that have registered for our upcoming course. We can't wait to meet you. And Dr. Irina Koifman, would you like to introduce yourself?
Of course. Hi, everybody. I am a partner in crime with Meredith, partner in chronic care leaders. We are true leaders in this space. We have been doing chronic care management for years separately. And then we met together and said, we need more nurses to learn how fantastic this opportunity is as a business for you, or if you like to do it as a what's called intrapreneur, which is working within your organization but learning something new, bringing it to the front, and this is the opportunity to get paid for the work that we are doing. So this is essentially Medicare herd providers who were complaining and saying we're doing all this work outside of the business office hours, calling prescriptions, verifying medications, ordering DME, talking to patients, explaining again their lab results or their disease state, and we're not getting paid. So Medicare said, fine, we can pay you for it, but it's not that easy. You need to have a patient consented to the program, you need to have a care plan, and then for every 20 minutes of your time, we are going to pay you. As you can imagine, very few doctors are doing it because they're already spread too thin. So this is where we as nurses come in and save the day. We have the education, we have the knowledge of local resources, we know how to connect with patients. So nurses should learn what chronic care management is as a Medicare program and find a doctor who is willing to work with them. And together with that doctor, both nurse can make six-figure income doing what you love to do most, which is take care of your patients. And doctor is not going to do anything. However, well, it's to, the doctor will talk to you and get your report. But I'm saying, doctor doesn't have to do this chronic care management, yet doctor still gets paid for working with you. So it's like win, 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 win from every direction. Patients happy, you're happy, doctor's happy. Meredith, do you want to talk a little bit about when the classes are starting, how much they are, and all the other logistics?
Absolutely. So if you were to buy the course tonight, all of the modules would be open to you to get dig right in and get to work. So you can come to our first live coaching call is September 15th at 7:30 p.m. Eastern Standard Time. So with the class, you get the modules of work, you get recorded lectures, you get free downloadables. These are all of your templates. We give you call scripts to get you started. I know you're going to find your own way and have your own, but we have everything you need to get you started and right on your way. And for all of this and us, 4 weeks, only $2,500. And you also get the bonus of remote patient monitoring, which this is the last cohort that's going to receive this bonus. After that, it's going to be sold independently because remote patient monitoring is separate and it will double, if not triple, your income. It's in the same family as chronic care management. We're still monitoring these patients from the comfort of our own home, but it's completely different service.
Yes. And just to reiterate, because people are asking questions, it is you'll study on your own. So it's not like, you come to class. So we have 8 modules with few bonus modules, and they're all open for you as of right now. So the earlier you can pay, the earlier you get access to everything. You can download it, use it, read it. But then what really sets us apart is the coaching calls. I don't know anybody that does weekly coaching calls, and Meredith and I are doing it. We are going to be, on Zoom with you, with the class, really going over whatever questions you might have. Maybe you have scenario. I talked to this doctor and these are the questions that he had, or I didn't know how to answer, or can the nephrologist do it, or I was approached by somebody and I'm not sure. Look, whatever the questions are, and especially based on what you read, if you have any questions, we're going to answer, we're going to brainstorm. We're also going to give you a lot of tools. For example, nurses, we notoriously think that we're not salespeople. We don't know how to quote unquote sell and how to market ourselves. So we have a lot of help with that. We're going to craft a elevator speech, something that you can tell somebody literally in the elevator. So 15 to 20-second thing to kind of, put a hook in to get that person that you're talking to say, oh, that sounds great. Let's sit down and talk more. So elevator speech, one pager. So when you're actually in the doctor's offices or, on your LinkedIn profile, you can post it. We also have call scripts. We have marketing materials. So we're not marketing gurus by any means, but both Meredith and I have been doing this successfully. Meredith has secured, she's working with 3 offices and getting 4th one, but she also had a lot of offices that she said no to, meaning that she has more offers coming her way than she wants to handle. Not that she can, but like you get to the point where sometimes you kind of look and like you already know. And, sometimes you kind of, in business, you can say, I'd rather let this go and get somebody else, something else. And I have been doing it and I've been getting clients that way too. So again, we're not salespeople, but, if you wanted to hire marketer or salespeople, you can, and that's probably going to cost you a few thousands of dollars. But so far we found that our nurses that took our class do not need any extra help, and they have been successful with the tools that we provided. Oh, and Meredith, last night I talked to one of the nurse practitioners that took our course. She's actually a Hopkins alumni, and she reached out to me. She is in Alaska, and she has a small home-based visiting practice on top of her full-time job. So she was able to implement CCM, and she's very happy. And she gave really positive feedback. She couldn't make actually our coaching calls because she worked, full-time plus kids plus this, her part-time business. But she watched all the recordings and she has all the documentation, and she was very happy with everything we provided. And she was like, you guys gave me so much knowledge, so much, information and passion. And just with my small cohort of patients, like I'll pay for this course pretty quickly. But also it's not only about, getting this to pay for something, or, we all want to be financially comfortable, but it's truly very rewarding because as let's say you're practicing nurse practitioner, like I talked to a friend of mine who is doing CCM. I introduced her to CCM and she loves it because she said every time a family member would call her for the 5th time asking about 5th different thing, she at some point she was like, and she's the kindest person I know, like Meredith. She's not, I'm a little short, I could be like, look, I'm going to see another patient, but she's so kind. And but she was like, at some point I'm thinking, oh my gosh, like if I was anybody, plumber, electrician, like you wouldn't ask me to come over again and again and not pay me, or call me with these questions and not pay me. And so she was getting a little irritated. And now that she's doing CCM, she was like, well, when I'm on the phone with patients, I really don't have to hurry, or, I know that I'm getting paid for my time. So I can, not spend more, but at least knowing, just knowledge that you can do a little bit more and take that a little extra step. But you're not taking away from your family, from not cooking dinner, from not going to gym. You're already doing it, so you might as well get paid. And again, this is great for nurse practitioners that have their own private business, but it's also fantastic for nurses that can bring that to the doctors who are not doing it. They're leaving money on the table. They're still taking care of everything. They're still answering the phone calls. They still, they're doing CCM. They just have no idea that they can bill for it. So you can come in, show them. And again, remember, the doctor doesn't have to pay you anything. You're not going to be on their paycheck. So there's no lose in terms of doctor. Like they have nothing to lose to try it with you. And you only need to find one doctor. And the last data I pulled, Meredith, is, let me just say real quickly, with 400 patients, which is pretty much full time. So 400 patients, when we just do 20 minutes, right? Because the 20 minutes is a minimum. That comes to 400 patients a month, comes to 6.6 hours a day. So 6.5 hours a day, right? So it's, it's a full-time job. 400 patients, like I wouldn't go be above 400 patients, but just doing CCM, straight CCM, no secondary 20 minutes, just 20 minutes plus care plan. It's about $230,000 a year.
Wow.
So it's close to $250,000 a year with working a little bit less than full time, working from your home, doing what you love to do more. And then, as Meredith said, we're also throwing a RPM, remote patient monitoring, which essentially will triple that because RPM is twice as much money, and you have a real data. Like, let's say blood pressure, you're going to be able to see blood pressure. So this is, kind of, right now it's buy one get one free. So when you think about it, you're only paying $12.50 per each course, which is very low. And next time RPM is going to be very separate with the same amount of money, maybe more. And you're also getting all the knowledge to be your own boss, to come up with your own six-figure income. And if you want to, as a second job, sell real estate or be a travel agent, it's fantastic and do it. But I always say, we have the knowledge, we have the power, we have the passion. Like, why are nurses looking to something else? Because they don't know that these options exist. The only thing that they know that there's a private duty nursing where you have to go to patients' homes, and home care agency, or maybe MediSpa or IV hydration, which are all fantastic businesses, but they all require you to be somewhere on the go, outside. And this is the business that you can do from home in your pajama, any time of the day, and make 3-4 times more than you do working full-time bedside.
You're absolutely right, Irina. And if I can touch on, having a family and, being a nurse, I'm a second generation nurse. My mother was a nurse. She worked every holiday. She worked every weekend. That was just the way our life was. And I was a SICU nurse. I worked weekends. I worked holidays. I was, even as a clinical leader, I would be the one that would stay late because I didn't want to leave, my coworkers in a bind and leave them working short. Here, you don't have to make those choices, and you can have more time with your family. You can cook dinner. You can get your kids off the bus. And, those are some of the perks of doing this kind of work. And not only you get more time with your family, you get paid more. So you have more financial freedom. And, that opens up a lot of opportunities for your family as well. So, it's just another great perk of this program. Chronic care management, I think I'm very passionate about it. It's needed more now than ever. We want to keep our elderly folks safe, well, and out of the hospital. And they do need our assistance. They need that wraparound care. And it does feel so good to give that to them. And Irina's right. We get to take our time and really look for everything that they might need and provide those services to them. And they are so happy and so grateful at the end of the day. It is, so it's a win-win all around.
Win-win-win. And the last win before we're going to go is Medicare had proposed new changes to the payment structure for 2022. And you guys are going to be astounded by, I've never seen Medicare to increase reimbursement so much because they really want doctors and nurses to do chronic care management. So remember the numbers that I gave you, that was for this year, for 2021, where code 99490, which is care management for 20 minutes of clinical staff, and it was about $42, or it still is about $42. It is increasing by $22, and it's going to be $64 from 42 to 64. It's like 50% increase. And every other code, there's a code for 60 minutes. It used to be $92. So let's say you actually did coordinate and manage patient for an hour. It used to be $92. So $92 an hour, which also not insignificant amount of money.
Right.
It's going to be $140 an hour. So when you just do that simple math, like your whatever numbers I gave you, you need to add 50% on top of it. And that's what's coming literally January 1, 2022. So you get this course now. You're going to be done by middle of October. You can start implementing it tomorrow. Like, you don't need to finish. You don't need it. And we had nurses in our previous cohorts that few weeks into it got a contract. But it's like, fake it till you make it. Enough to get started. We'll help you along the way. And then, by the time you actually start seeing patients, managing patients, and getting paid, we're talking about that your reimbursement is going to be 50% more than what Meredith and I are making right now. So amazing time to start. We
Yes.
can't wait to see you. Please register. Oh, and you can, oh my gosh, we forgot to say, you can buy it on nursepreneur.com/chronic care leaders. Let me see if I can write it here.
In the chat.
Yeah.
And while Irina's doing that, this just goes to show you how much Medicare believes in these programs, that they're willing to put the money into these programs. So it has never been a better time to get going, to learn all you can about these programs. And really, I think Irina and I are pioneers in this. There's no manual. You're not going to find the information we're going to give you online. You're not going to find the templates we're going to give you online. So our course is very unique. We set you up for success. We give you that roadmap. And I do hope to see you guys on September 15th. I'm really excited. I know Irina is excited as well.
I'm very excited. And unfortunately, I can't write here. Meredith, I don't know. Can you?
Yep, hang on a second.
Okay.
Let me
and
grab that.
To answer your question, Tina, you don't have to seek a independent provider. I don't know how many of them are actually left, as in like one doctor in the office, but you can absolutely and should absolutely look for providers that bill Medicare fee for service, so they're not part of the HMO or ACO, because there are many that are, and also not doctors that are owned by the hospitals. Now, hospitals keep acquiring these primary care practices. And so they just, it's not that they don't want to do it or they can't, but they're not the decision makers. So once you find this one doctor, literally all you need, one doctor can give you hundreds. Like normally every primary care doctor has to give you about 500 patients for you to manage. It's because, I can go through the math, but we've done it before. It's one doctor gives you full-time business, and then they're going to give you more, and then they're going to tell their friends, and then you can choose to either stay independent like me and just keep saying no, or you can choose to do what Meredith does, is getting more contracts, hiring more nurses that work for her, and then grow that way. So yes, it would be great to get if you know anybody, primary care providers or even specialists who are independent in a way that they're not owned by a big large group. They need to be, basically you need a decision maker. So that's what you need to do.
Social workers. So social workers, you could consult your patient. You can consult with a social worker, but really the nurse is connecting the patient to these, all of these social elements.
Resources. Yeah. But also, I don't know, Keith, if you're a social worker or why you're asking, but social workers can do CCM as well. Like you don't have to be a nurse. You just need to be licensed in the state. And Medicare is not particular about what license you have. I mean, obviously not a plumber but healthcare license. So even like LPNs can do it. Even MAs can do it. Social workers. I know many pharmacists that are actually getting into the CCM field. So social worker can. The only thing is, with chronic care management, there has to be medication reconciliation. So it would either have to be done by a doctor, or as a social worker, you can call a pharmacy and ask for them to reconcile medication. So it's all doable. So social workers can and should think about it. We're just biased because we're nurses. So we are catering towards nurses, but social workers are welcome. Absolutely. Do we... any nurses or nurse practitioners only? So no, it's, again, as I said, I think, and I don't know if you wanted to maybe specify of who you are, but it's Medicare said it's clinical staff, and CPT definition of clinical staff, it's very vague. It's basically anybody that's licensed or certified in the state to, then I've been saying, like, to provide care, basically certified or licensed in the state, and or there's a policy at this doctor's office to specifically say that you can do this chronic care management. So let's say maybe, and I've seen it before, like doctors can hire a somebody that's not a true medical, not a certified medical assistant, but somebody that runs the office, and they call them like office manager, medical assistants, and a doctor can train that person to do CCM, and that's okay too. But nurse practitioners that have their own practices, absolutely, like they have to do CCM, otherwise they're losing money. So why not do it? And nurses can and should do that as a business and kind of sell that to the doctors.
Absolutely. Nurse practitioners, think about all the calls that you field just on a daily basis at work. You can get paid for all of that time you're spending coordinating the care of those patients. So by not joining, you're leaving money on the table.
Yes. So learn how to do it, start billing for it, provide amazing care to your patients, put more money in your pocket, and everybody's going to be happy. And remember that next year in January 1st, reimbursement goes up by a lot. And I think that a lot of the RPM companies that don't provide chronic care management are now going to kind of start gearing towards CCM, because RPM actually is losing a few dollars a month, where CCM is gaining a lot. So this is a great way to mix both and have your patients participate in chronic care management, add remote patient monitoring to it. The opportunities are endless. We can't wait to see you. If you have any other questions, ask us. And if not, please go to nursepreneur.com/chronic care leaders. You can read a lot more about it. Meredith and I are also pretty vocal on Facebook and on LinkedIn. So find us, ask questions, but hopefully we'll see you guys soon. And next Wednesday at 7 p.m. Eastern Standard Time, we're starting our very first coaching calls. So have a great night, everybody.
Yes, have a great night. I'm looking forward to seeing you all September 15th at 7. Stay safe.
Bye.
Bye.